This investigation was on the role of extrahematologic comorbidity in the survival of the patients with myelodysplastic syndromes, carried out by Dr. Adela Perolla, from University of Medicine. Service of Hematology, UHC, Mother Teresa, Tirana, Albania.
I'm starting now with the role of extrahematological comorbidity in survival of patients with myelodysplastic syndrome. So to have a short look on myelodysplastic syndromes, it's a clonal disorder with of multiple bone marrow stem cells, and it's characterized with cytopenia, dysplasia of one or more myeloid cell lines, and also with an ineffective hematopoiesis and increased risk to development of acute myeloid leukemia. About 20 to 25% of the patients with myelodysplastic syndromes develop acute leukemia, mostly myeloid acute leukemia. This is the etiology of myelodysplastic syndromes. 85% would be de novo, or for the first time, idiopathic or primary, and the median age of the patient diagnosed with primary or de novo myelodysplastic syndrome, it's around 21 years. And increasing the age, this risk will increase more. 10 to 15% of this clonal disease is due to ionizing radiation, DNA alkylating agents, for example, chlorambucil, melphalan, or other chemotherapies that are used on cancer treatment. And mostly the syndrome of myelodysplasia peaks on 5 to 7 years follow the exposure of these agents, and also less than 5% is due to the exposure to topoisomerase 2 inhibitors like etoposide and anthracyclines. So shortly, those are the risk factors for myelodysplastic syndromes. Mostly it's environment, aging is the top of the list, exposure to DNA alkylating agents and topoisomerase, as I said before, but also it's important the exposure to ionizing radiation, and mostly the people who work with hydrocarbons. Also, it will be an antecedent acquired hematological disorders like aplastic anemia and hemoglobinuria, paroxystic hemoglobia. It will be 5 to 25%, and it's also occur also in the myelodysplastic syndrome, also in inborn patients like with Fanconi anemia, and we have here the RANKS mutation, GATA2 mutations, and also we have other congenital bone marrow failures. So as I said before, the myelodysplastic syndromes are tied with aging. More we age, more we have mutations accumulated in our DNA, and this can cause the myelodysplastic syndrome, as is shown in this image. So here we have the young hematopoietic stem cell. Normally we have the myeloid and lymphoid line, as you see it with purple and green. And after we age, going older and older, we have this mutant clone and the ineffective hematopoiesis. But in the meantime, when we age and have these mutations in our DNA that predispose us to have a myelodysplastic syndrome and the monoclonal disease, or a malignant disease, if we see the epidemic, the global epidemic of age-related disease, we have a lot of age-related disease. So more we age, more we have the possibility to have the heart disease, cancer, stroke, emphysema, pneumonia, diabetes, and the other. And so this is important when we speak for older patients who are diagnosed with myelodysplastic syndromes, but meanwhile can have also these other diseases. So mostly if we have a comorbidity in a patient with myelodysplastic syndrome, this significantly worsens their survival. If we see the epidemiological data on myelodysplastic syndromes, we see that mean age of diagnosis is 65 years, but it can affect any age, also less than 50 years old, but it's uncommon, and also in youngs and children. But the true incidence of myelodysplastic syndromes is 5.3 to 13 for 1,000 million inhabitants, and in patient age that more than 65%, the incidence is growing higher, with 75 to 162. What is the role of comorbidity or extrahematological diseases? This can create an unfavorable effect on life expectancy, can influence the clinical decision making, what we can treat, what can we use with these patients to not worsen the other diseases, and also affects the therapeutic strategies. And this is the major reason for an undertreatment of these patients. What is the probability of survival of these patients? Well, it depends of the presence of these comorbidities. The cumulative probability of survival and risk of non-leukemic death, if you see the studies here that are, it was a study created from Policlinico San Matteo Pavia in Italy in 1992-2007, you see the probability of survival of the group A of patient without comorbidity and the patient of group B with comorbidity, and you see the difference is high. The patient without comorbidity and diagnosed with myelodysplastic syndromes live longer compared to those who have more than one comorbidity. Also, it was a study published in the Leukemia Journal, and this was in 2009 from Wanger. And also here a study was done for the 1,700 patients with myelodysplasia aged more than 66 years. And the patient with comorbid condition had significantly greater risk of death compared with of those without comorbidities. And now I present the statistics of Albania, an Albania study. So the study, it was the role of extrahematological comorbidities in the survival of patients with myelodysplastic syndromes. It was inside of a big study on biological findings and survival on myelodysplastic syndrome in Albania. And it was a total of 294 patients have been accumulated during the period of 1999 to 2013. And this was diagnosed with myelodysplastic syndromes in our University Hospital Center, Mother Teresa, and classified at the time with FAB and WHO 2008 diagnostic criteria, and was classified in two major age groups: those with myelodysplasia but less than 60 years, and those with myelodysplasia but more than 60 years. And they were classified also with a number of comorbidities, with no comorbidity, one comorbidity, two, and three and more comorbidities. And what was the result? So the non-hematological comorbidities studied was cardiac disease, cerebrovascular disease, renal, endocrinological, gastroenterological, autoimmune disease, psychiatric diseases, and neoplasms. We studied the incidence and the survival. So age and sex-related incidence of myelodysplastic syndrome, as you see in this image, was 65.3% of patients were more than 60 years old, and only 34.6% was less than 60 years old. And on this situation, those who were less than 60 years old, female and male ratio was equal, but the older we get, we have more patients, 63% were males. So the male are more predisposed to develop myelodysplastic syndromes. And the concomitant diseases are that 26% of patients were without comorbidities at the moment of diagnosis with myelodysplastic syndromes, and about 74% of the patients had one or more comorbidities. And here we have the patient, 43% had hypertension at the moment of diagnosis, 10% have benign hypertrophy of prostate, and also we had 19% of patients with diabetes mellitus. The other diseases were less but not significant in the diagnosis and in like comorbidity in these patients. But we had a study on survival, and we found that the presence of comorbidities at the moment of diagnosis is an independent prognostic factor on the survival of the patient diagnosed with myelodysplastic syndromes. But, and I have to tell this, it has no impact on the evolution of these myelodysplastic syndromes in acute leukemia. So the presence was important in the longevity of these patients at the moment of the death, but not at the point of transformation in acute leukemia. And that, as you see, the survival function, the P is significant, P 0.0016, and this was non-significant comparing to the transformation of myelodysplastic syndrome to acute myeloid leukemia. What we have to take home notes. Myelodysplastic syndromes are neoplasms of bone marrow stem cells and have an increasing incidence with age. With aging, we have an increased prevalence of comorbidity, and the subjects age more than 64 years and older suffer on average for more than 3 concomitant diseases, so non-hematological diseases, and the comorbidity had an unfavorable effect on life expectancy in these patients, influenced the clinical decision, and affect the therapeutic strategies. And the most important thing is the presence of comorbidity at the moment of the diagnosis. It's an independent prognostic factor of survival, but it has no impact in evolution of these myelodysplastic syndromes to acute myeloid leukemia. Thank you very much.
Thank you very much.